Welcome to my channel. Subscribe or like if you like. Today we will explain the active principle Tadalafil. We will talk about its side effects, its dosage, contraindications, warnings, its mechanism of action, pregnancy, breastfeeding and much more. What is Tadalafil? Tadalafil is a medication used to treat erectile dysfunction, benign prostatic hyperplasia and pulmonary arterial hypertension. It is similar to sildenafil, but differs from sildenafil in that the effect of Tadalafil is longer, lasting up to 36 hours, while sildenafil works for 4 to 5 hours. The trade names of Tadalafil are Cialis, Adcirca, Alyq, Tadacip, Taedallis. Mechanism of action of Tadalafil. Powerful and selective inhibitor of phosphodiesterase 5, PDE5, an enzyme of the cavernous bodies responsible for the degradation of cGMP. Therapeutic indications of Tadalafil. Erectile dysfunction in adults. Treatment of the signs and symptoms of benign prostatic hyperplasia in adult men including those with erectile dysfunction, 5 mg dose only. Pulmonary arterial hypertension, PAH, functional class 2 and 3, WHO, in adults to improve exercise capacity, proven efficacy in idiopathic PA and PA associated with connective tissue disease. Pathology and dose of Tadalafil. Oral route. Adults and elderly. Erectile dysfunction, 10 mg at least 30 minutes before intended sexual activity, with or without food. If no adequate effect occurs, increase to 20 mg. Maximum frequency 10 to 20 mg per day, 1 dose per day. Not recommended for continuous daily use. In patients who expect more frequent use, at least twice a week, recommended dose, 5 mg per day, at the same time. The dose may be reduced to 2.5 mg per day, depending on tolerability. Benign prostatic hyperplasia in adult men, 5 mg per day, at the same time, with or without food. Severe renal failure, maximum 10 mg. Not recommended with severe renal failure, 2.5 or 5 mg daily. Liver failure, maximum 10 mg. Severe liver failure, limited data, evaluate benefit risk. Pulmonary arterial hypertension, 40 mg once a day, with or without food. Mild moderate renal failure, 20 mg per day, based on efficacy and tolerability increase to 40 mg per day. Mild moderate liver failure, 20 mg, evaluate risk-benefit. Mode of administration of Tadalafil. Oral route. A. Erectile dysfunction, administer with or without food. However, you may notice that it takes a little longer to take effect if ingested with a large meal. The intake of alcohol may make it temporarily difficult to obtain an erection. B. Pulmonary arterial hypertension, administer with or without food. Side effects and adverse reactions to Tadalafil. Hypersensitivity reactions. Headache, syncope, migraine. Blurred vision. Chest pain, palpitations, flushing, hypotension. Nasopharyngitis, including nasal congestion, sinus congestion and rhinitis, epistaxis. Nausea, dyspepsia, including abdominal pain/malaise, vomiting, gastroesophageal reflux. Rash. Myalgia, back pain and extremities, including limb discomfort. Increased uterine bleeding. Facial edema, peripheral edema, fatigue, chest pain. Diarrhea in people over 65. Contraindications of Tadalafil. Hypersensitivity. History of cardiovascular disease. AMI in the previous 90 days. Hypotension, blood pressure. Treatment with any form of organic nitrate. Patients who present loss of vision due to previous non-arteritic ischemic optic neuropathy, whether or not they have been previously exposed to a PDE5 inhibitor. Unstable angina or angina produced during sexual activity. Heart failure corresponding to class 2 or higher in the previous 6 months. Uncontrolled arrhythmias or uncontrolled hypertension. Stroke in the previous 6 months. Co-administration of PDE5 inhibitors, including Tadalafil, with guanylate cyclase stimulators, such as riociguat, since it can potentially produce symptomatic hypotension. Warnings and precautions with tadalafil. Liver failure, evaluate risk-benefit. Severe kidney failure, not recommended. Anatomical deformity of the penis, angulation, cavernous fibrosis, Peyronie's disease, or history predisposing to priapism, sickle cell anemia, multiple myeloma or leukemia. Not recommended in cardiovascular disease, clinically significant aortic and mitral valve disease, pericardial constriction, restrictive or congestive cardiomyopathy, significant left ventricular dysfunction, arrhythmias, symptomatic coronary heart disease, uncontrolled hypertension, occlusive venous lung disease, retinitis pigmentosa. Risk of visual impairment and cases of non-arteritic anterior ischemic optic neuropathy. Before starting treatment, rule out the presence of prostate carcinoma. Not recommended in combination with alpha blockers, doxazosin, or other PDE5 inhibitors or other treatments for erectile dysfunction, or in patients who are chronically taking potent inducers, rifampicin, or potent inhibitors, ketoconazole or ritonavir, of CYP3A4. Risk of priapism. See your doctor if you experience erections lasting 4 hours or more. Warnings and precautions in patients treated with bosentan or prostacyclin or their analogs. Avoid excessive consumption of alcohol. Concomitant use with antihypertensives, adjust doses of the latter. Effectiveness is not known in patients with spinal cord injuries and undergoing pelvic surgery or radical prostatectomy without preservation of neurovascular bundles. Not recommended in children under 18 years old. If cardiovascular symptoms appear at the beginning of sexual activity, it is recommended not to continue and inform the specialist. Liver failure and tadalafil. Erectile dysfunction, caution in liver failure, recommended 10 mg. In severe liver failure, limited data, evaluate risk-benefit. The daily administration regimen has not been studied. Pulmonary arterial hypertension, mild to moderate cirrhosis, after single dose of 10 mg, consider starting dose of 20 mg, evaluate risk-benefit. It is not recommended in severe hepatic insufficiency. Renal failure and tadalafil. Erectile dysfunction, caution in severe renal failure, maximum 10 mg, daily administration is not recommended. Pulmonary arterial hypertension, severe renal failure, not recommended. Mild to moderate renal insufficiency, initial 20 mg per day, based on efficacy increase 40 mg per day. Interactions with tadalafil. Plasma concentration decreased by phenobarbital, phenytoin, carbamazepine, rifampicin. Pregnancy and tadalafil. There are limited data on the use of tadalafil in pregnant women. Animal studies show no direct or indirect harmful effects on pregnancy, fetal embryonic development, delivery, or postnatal development. As a precautionary measure, it is preferable to avoid it during pregnancy. Lactation and tadalafil. Pharmacodynamic and toxicological data available in animals have shown excretion of tadalafil in milk. A risk in the nursing infant cannot be excluded. It should not be used during breastfeeding. Effects on driving ability by taking tadalafil. No studies have been conducted on the effects on the ability to drive and use machines. Although in clinical trials the frequency of dizziness reporting was similar in the two treatment arms, tadalafil and placebo, patients should be aware of how they react before driving or using machines.